Good afternoon, good day, whatever time of day it is. Hello, my name is Kwesi Willisi, and I am a employee here at Health Choice Network. I am a chronic disease specialist, and my focus is around HIV, STDs, and hepatitis. And I'm very pleased to present to you today my presentation on my project, The Impact of Universal HIV Screening Policy Implementation on HIV Screening Rates Among Selected Federally Qualified Health Centers. So I know that's quite a mouthful, so we're just going to go ahead and get into it. So before I continue, I'd like to read this disclaimer from Gilead Foundation. The Focus Program, which is what my project is a public health initiative that enables partners to develop and share best practices in routine bloodborne virus, HIV, hepatitis, as stated before, screening, diagnosis, and linkage to care in accordance with screening guidelines promulgated by the CDC and also United States Preventative Services Task Force. Um, and includes state and local public health departments as well. Focus funding supports HIV screening and linkage to care to the first appointments after diagnosis. Focus partners do not use focus awards for activities beyond linkage to the first appointment. So, with that said, we can get into the basis of this project. So, opt-out screening or universal screening is defined as conducting HIV testing among all members of a health center, all clients of a health center, provided that they're aware of the fact that they can decide not to be tested, they can decline the test, but making pretty much by policy screenings be for HIV and other bloodborne pathogens be the standard of care. Many network members do not have opt-out screening as a policy. Consequently, many clients at risk of HIV are not screened as recommended by CDC and the United States Preventive Services Task Force, as I mentioned before. So our goal of this project was first to implement an opt-out screening testing policy at participating health centers and standardize the advanced routine screening and diagnosis of HIV. In addition to that, we wanted to assist our community health centers in connecting individuals to care and also train and educate HCN member clinicians on HIV best practices. So our project design is pretty much based exactly on what our goals were. So we engaged multiple organizations to share best practices and work towards quality improvement projects, including specifically screening for HIV and standardized opt-out testing as HIV screening policy for participating health centers. And we also leverage our electronic health records system in order to help us better identify clients that need screenings, as well as those that may benefit from other prevention efforts, including biomedical intervention like PrEP, and also link HIV positive clients to care and correctly collect reliable testing data. Through that, we were able to establish a status neutral approach. We borrowed this diagram from New York, which is where the phrase was really coined, where individuals through opt-out screening policy increases the amount of people who come in to get screened and also allow us to mend those spaces where individuals that could be screened for HIV and would normally be missed. If they're positive, we link them to care immediately. If they're negative, we include them into some biomedical intervention, including PrEP, as we said before, and we also incorporate that with condom usage. With that happening, the chances of transmitting uncontract and contracting HIV dramatically reduces or is reduced. Pardon me. So the outcome, the HIV screening measure captures the percentage of patients aged 15 to 65 at the start of the measurement period who were between 15 to 65 years old when testing for HIV, which is actually a UDS measure for screening. Three other participating health centers show a significant increase in their screening performance after the policy adoption, and one health center had only a small increase. Another one experienced a decrease in their screening activity, and this may be due to a myriad of things, considering that a lot of this stuff happened during COVID. So, there could have been internal issues with staffing and so on, and that is something that we have to look more closely at. But the pre-implementation period was from May 1st, 2019 to February 29, 2020. And the post implementation period was from May 1st, 2021 to February 28, 2022. During the project, there are approximately 43,000 tests conducted, of which 32 were first-time diagnosed, and 65%, which 21, of these newly diagnosed were linked to care within 30 days, as according to CDC recommendation. There were 175 clients that were previously diagnosed with HIV. 31 of them were re-engaged in care, which we're happy to see, so that they're part of the care continuum, and others were already in care. Fourth generation testing played a major role in the diagnosis of 2 acute HIV cases that were immediately linked to care. Some of the challenges and lessons learned, well, we know it works. Universal screening, of course, will increase HIV screening and also help us to identify cases in early stages of infection. A universal screening, when implemented through policy adoption in a health center setting, will reduce provider burden, increase the number of HIV screening, reduce HIV testing stigma, and HIV screening as a routine practice of care. Now, this is interesting, or should be of interest to many, because this is the first time this is done on a network level and on a hospital system. So we're looking forward to see how this will grow. We already have new members that have already jumped on into the project. For more, if you have any questions or so on, my information will be attached through the poster, and I'll be more than happy to answer. So once again, I want to say thank you for your time and enjoy.